So are you too young for a facelift? Sure, there's definitely people who will come consult with us to decide whether or not they're a surgical candidate, and yes, they are just not there yet. It tends to be sort of just a number, but in general, there's very few people, even really in their 30s that are great candidates for facelifts. With the advent of all the GLP-1 medicines and things and massive weight loss, that has increased the number of, let's say, 30-year-olds that have been to our office to get facelifts, but that's normally after a drastic amount of weight loss. I have had some, people in their 30s that were good candidates for maybe something more of like a mini lift. It's not a term that I like to use very frequently at all. Underneath the skin, it's still a deep plane face and neck lift, but the incision can tend to be a little bit shorter. And honestly, the changes tend to be a little bit more minimal. And not to say that they're not profound, but the change from A to B is less of a gap than if you were, let's say, 65 years old compared to when you're 35. Most people don't have the laxity, they don't have the jowling, the changes that really stack the odds in our favor, that the benefits of doing surgery far outweigh the risk. And as I always say, the risks are very minimal, and not to scare anybody away, but if the benefits and the change that you receive from surgery doesn't create a big enough gap for me, I'll often tell patients that it's just not the right time. And yes, it's not fun to tell people that, hey, we can't have a procedure that can get them where they want to be. But it's the right thing to do. And timing in this world, whether it's surgery or anything, is the most important thing. And I think that that's really where we judge it on an individual basis. So yes, you can be too young, but in some ways, age is just a number.